Susan has been a real asset to my classroom. She's teaching lessons that they can connect to and they can value. Anytime they're drinking something or they're eating something, they're looking at the nutritional label. It's really positive, and they're taking this home and applying it to their lives as well. And we've worked with the mayor's office before, and you will see that what you've done will benefit the student, that the students, they really appreciate it. Whatever they learn, we want them to apply to their daily lives, take it home, work with their children, share with their family members. If the students are more aware of the benefits and what's out there and where they can go and get all these healthy foods, I think, we'll see a change in their diet and in their lives.
I think this program helped me with interacting with the students, making it relatable for the students and making sure that they're interested in what they're learning, and so they get a lot more out of it.
I would say she is very thorough, and her approach is not too fast, but slow in the sense that so you would understand. She takes her time, and she pronounces her words thoroughly so that you can understand. And that helps.
Well, Nix has influences students in a major way, and she generally has been very popular. Most of the students are thrilled that there's an aspiring doctor in the group.
My name is Richard Kobnawood. I'm from Africa, Ghana. Some people, English is not their first language, and going to the doctor's appointment and all that, sometimes people have to get interpreters or somebody who can explain the English of the doctors to them. Julie and Rachel, they are very wonderful people. They got time, patience, and they come down to your level. Forgetting about their standard, they come down to your level, make sure you understand what you are doing, and then explain things to you very clearly, and they have a spirit of humility in them.
Yes, my name is Mr. Veles, and I am a literacy instructor here. And so far, so good. The program is getting better by the minute and making people focus on the diseases that are affecting the community, which is mostly composed of Hispanics and African Americans. An ounce of prevention is sometimes better off than a pound of cure. And their work here is very, very significant because, diseases such as high blood pressure, heart disease, HIV, diabetes, all these maladies are affecting our community. And again, with their work, awareness and some sort of prevention is actually happening through their work, and it's very good.
Because much of health literacy is about navigating the healthcare system, the fellows were taken to the city's leading healthcare facilities to learn about innovations in clinical practice that improve healthcare for the 40% of New York City adults who can't speak English or who have limited literacy.
So you all have now been indoctrinated into my little program, and what you're going to be doing is you're going to be going on a scavenger hunt of the facility to learn what it's like to be a patient here and to try to experience it firsthand. I've broken you into groups of 2. You each have a packet with your scavenger hunt tasks. There are some educational things worked into this, so enjoy them.
On our trip to Gouverneur, we went on a scavenger hunt where we basically had to navigate our way through the hospital just as any patient coming. There's something really inherently difficult about going to the hospital because there are so many steps before you can actually go see the doctor. You have to go here to register as a patient for the hospital, and then you have to go to this different place to triage.
In terms of health literacy, I've been very impressed by the mayor's office being so proactive about this fellowship, because I think they're correct in that it started some medical school and really getting into the medical school curriculum this idea that really we should view all patients as having limited health literacy and then take it from there. Talk with patients. It's really basic communication skills, and identify patients who for whatever reason might have limited health literacy is the beginning of, I hope, a breakthrough in the way we provide care to everybody. I'm so excited because I think there really is a big movement now to make this a real issue. and to really help patients. You know, if you don't really deal with this issue, then you really can't deal with any other issue. So it's the basics, it's where you start.
Errors in patients' understanding of how to give medications can really have huge implications. Medication errors actually cause more deaths in MVAs than breast cancer or AIDS. If you have low health literacy, you're going to have problems with reading and interpreting prescription bottles. I think that's the area I'm going to kind of focus on today, just because that's the area where kind of health literacy in patients and in people really comes into play. Health literacy is really an issue that's particularly important for patients here at Bellevue Hospital because we serve a very diverse population, people from many different cultures who speak many different languages. And today we're having the fellows come for a visit so that they can see Bellevue Hospital and they can learn about things like our interpreting services and other programs that we have for families.
You want interpreting whenever the provider and the patient don't speak the same language. In this system, the interpreter hears both parties all the time, but when they communicate, they only communicate with one at a time, and that's part of what simulates the direct communications. You only hear your own language.
It's done in the first person to keep the flow of keeping the interpreter invisible. And so if the doctor says, you know, have you been taking your medication, we say exactly, have you been taking your medication? Not, oh, tell her I ran out. It's no, I ran out. Y pues no siento nada, pero al momento de quizás como a las 12:30 de la madrugada.
Something that it comes all of a sudden. I could be cooking, being at work, and all of a sudden the pain is so intense on the right side, right here, and it feels so deep, and I don't know how to explain it anymore.
Definitely, I can see why you're concerned. Just how often does this happen?
The simultaneous interpreting, it was just a great innovation. It's really good to see that they're making this a priority in terms of their delivery of care and making sure that patients don't have that barrier.
Medical students can make important contributions to the published research. Fellows conducted research on an impressive range of topics, including plain language. They analyzed common written documents from hospitals and assessed whether adult learners could understand.
We are having this discussion together today so that hospitals can make the documents better for patients. Like say you took someone in your family, right, and they're the one with the cut, and they give you this. How would you explain to that person what this document says?
Yeah, so each individual is going to come out with something different. That's basically what I was saying. That you might read it a certain way, but not everybody's going to read it a certain way.
What's large to you might be small to somebody else. They should check off which one applies for the patient.
Okay, so you're saying that a laceration is a laceration and you need antibiotics regardless. Is that what you're saying?
It may have already been infected while you were at the hospital.
Okay, I've never heard of that.
Before you got there.
You do have a valid point.
To see one point be confused by so many people, and I think the biggest point of discussion was something that said the physician has decided to give you antibiotics. The physician has not decided to give you antibiotics, and I think the form was made to make the life of the physician easier because you can just cross one thing and not the other.
I think that they're doing important work. For example, the Plain Language Project, where they're carefully examining all kinds of health-related documents that are given to people at health centers and hospitals, and they're evaluating it. And I think these medical fellows are meeting their future patients. I think that it's a case where we're all meeting people that we wouldn't ordinarily meet. Where else would I be meeting people from the mayor's office and the medical fellows, and where else would my students be meeting the medical fellows? So I think it's a chance for all of us to get out of our comfort zones and get into new situations and learn from people we might ordinarily not be meeting.